prepare for our single bonding.
Yeah.
So that,
Yes.
and that's what I'm looking for.
Good morning, everybody. How are you?
I'm from Dutcher.
Can you all hear us okay?
Yeah.
Perfect. So good to see everybody.
We're on the call yesterday.
Good morning, Jessica. Good to see you.
I'm contextually figuring out my own
Let's
way.
see here. Looks like we have a couple people missing. Might give them a minute or two to join, since we do have a little bit of a longer meeting today. Right, can everybody see the agenda on my screen?
Yep, we can see it.
Perfect. Sounds good. Right. Good morning, Dr. Rice, how are you?
I'm good, thank you. Wish I could be with you, but I am actually out of state right now, so
Oh,
couldn't
nice.
join you guys.
Well, we were talking about possibly doing another one in October, up here when all the leaves have changed and everything's absolutely beautiful. The drive up, you could like start to see like a couple of the leaves, like, I was like, oh gosh, it's time. Like,
We're almost there. Oh, it's supposed to be 80 and sunny.
Your 1 month summer is over.
I know.
I was thinking this is it. The Farmer's Almanac says that Colorado is going to have a very brief fall and a hard winter, and I'm really hoping they're wrong. I'm really hoping they're wrong.
I mean, if we get some good snow, I wouldn't be opposed, but.
Oh, it would be nice to take care of that the beetle infestation.
Yeah, that would be true.
Such an Indian summer. Last year we had
Great, everybody.
70-degree weather until the first.
So,
No snow.
Jennifer is not gonna be able to join us today. She had a family emergency, so Michelle, are you all right to act as the chair today?
I am. I'm actually pulling up documents. Didn't you send the bylaws and all that?
Yes, so it's all linked within the agenda, and I'm gonna drop the chat for the agenda, or excuse me, I'm gonna drop the link for the agenda in the chat.
So 10:05. Are you taking notes?
Where's Jessica? Okay, yeah, that'd be great.
We'll call the meeting to order 10:05 as meeting called to order. Yes, I too say welcome. Hi, good to see all of y'all online. Welcome. Good morning. We have a couple new people that we did office hours with and got onboarded. So maybe we could do a quick round of introductions. Just in case anybody has missed the new folks, we can make sure that they're oriented and everyone knows who they are. Our board is expanding. It's really exciting to be able to have additional people. So like Caitlin said, Jen Vasquez is out due to a family matter today, but she is our board president. She has been on this board for about 6 years, and she works in Denver up at the state hospital. I'll let her talk more about herself when she comes back. My name is Michelle Muthing. I'm the vice chair. Today is actually the anniversary of my 2nd year on this board. And so I have switched, but I represent the private sector, the world of crisis. And I live up here in the Western Slope.
Good morning, Katie Donahue. I'm formerly with the Denver City Attorney's Office, where I was for 5 years practicing mental health law. So really getting into Title 27, 50, 65, geez. Handling involuntary commitment hearings. I've also done a lot of policy work with the mayor's office there and sat on the working group for the 2765 rewrite. So I'm happy to be here, brand new. I think this is my first official meeting, so.
Yay! Welcome, Katie.
It's good to have.
Tiny.
So James McLaughlin, I go by Tiny, and I'm the Director of Community Paramedicine with UPass Regional Health Service District. We are the mobile crisis provider for just about 4,000 square miles that include Olive Park, Olive Teller, a little bit of Douglas, and a little bit of El Paso. And I represent rural behavioral health.
Hi, everybody. I'm Caitlin. I am the Boards and Commissions Coordinator for BHA. So you're going to hear a lot from me if you haven't already. But really happy to be here with you all and super excited to welcome our new members today.
I'm Andrea Jones. I am the Deputy Policy Director over at the Behavioral Health Administration and sort of oversee Caitlin's boards and commissions functions and units as well.
Welcome
Thank you.
online. I'm just going to go across my screen of who I've got. Dr. Simpson, welcome. Good to see
Hi.
you.
Yeah, thank you. So Scott Simpson, I'm a psychiatrist at the University of Colorado School of Medicine. Clinically, I practice emergency psychiatry and did that at Denver Health for just short of a decade, which was a space I loved clinically, just working with individuals, families, thinking about how crisis and emergency care is really an opportunity to extend good behavioral health care to a lot of underserved communities, interacting with paramedics, Ms. Donahue, the city of Denver, and correctional care. And a few months ago, I moved to the University of Colorado's School of Medicine proper. I'm the director of the Division of Community, Population, and Public Mental Health, and we lead a lot of programs in support of activities outside the main Anschutz campus, including mental health hospitals at Pueblo and Fort Logan, Department of Corrections, a lot of community work with CDPHE. This, again, is my first meeting, so really looking forward to working with everyone in this context.
Wonderful. Casey Wolfington.
Hi, everyone. I am with you. I am seeing little tinges of yellow on my trees, and I will tell you, I'm totally not ready. It's so early this year. So, but hi, everyone. I'm Casey Wolfington with Vail Health Behavioral Health. I am our Senior Director of Behavioral Health. I am a psychologist by training. I oversee our outpatient, inpatient, soon to be inpatient, I should say. We are going to be opening a 28-bed inpatient psychiatric hospital. It is set to have construction completed in January and then open to first patient in May. We have outpatient services, crisis co-mobile response, school-based health services. Many of our services are modeled on the fabulous work that Michelle created in Aspen. And I oversee our psychiatry team, anything clinical, basically I oversee. And I work a lot on regulatory policies, compliance. And so I'm really excited to be part of this team.
Welcome, welcome.
And Casey, if I could just throw out a big thank you for all of your help over the last several weeks as we prepare for our policy stuff. Yeah, you've been very helpful. Thank you.
Oh, of course. Thank you.
Dr. Rice.
Hi, everyone. I'm Karen Rice. I am the Chief Medical Officer at Mental Health Partners, which is Community Mental Health Center for Boulder and Broomfield counties. Next time I see you guys, we will have merged with Clinica. It's the FQHC in our area. So we will take on their name. It'll be Clinica Family Health and Wellness. So lots of big changes coming our way. Yeah, I've been on this panel now, I think, or committee two years? I'm losing track of time myself. Welcome to the new people.
Absolutely. Cassie.
Hi everyone, I am Cassie D'Amato and I serve as Summit Stone Health Partners Director of Acute Services in Larimer County. So we are a comprehensive service provider, essential service provider. That we have, inpatient, outpatient, all things community-based and acute services. So I oversee all of our acute clinical programming, including our withdrawal management, crisis stabilization, urgent care, 3237 withdrawal management and residential care, and our co-response and mobile teams. So excited to have some new members in this group. I, like Dr. Rice, have lost track of time, but I know that I'm in my second term on this.
Right. The days just run together. Renee, and if I'm not mistaken, I think I missed the beginning of your introduction the other day online, but you're a physician as well, yes?
Yes, hi, Renee Marquardt. I am the Chief Medical Officer at CDHS, and I'm representing CDHS on the board here. I'm also new. This is my first day. And yeah, my clinical background, I'm a child and adolescent and adult psychiatrist. Most of my clinical career was in California. I've been with CDHS for about 5 years, and as I'm sure folks know, we operate the state psychiatric hospitals, as well as the juvenile justice sites and regional centers, et cetera. So a lot of overlap with these issues here on board. Happy to be here.
I love it. Thank you, Dr. Marquardt. Okay, I think that's everybody, and I don't see that we have any guests. Did we not? We said we weren't going to do that this time, were we, since we were doing bylaws?
Mhm.
Okay. All right. Does anyone have anything to add to the agenda? Anything that they would like to discuss aside from what Caitlin sent out today is mostly our bylaw review and our letters, the process moving forward that we're going to be taking on with reporting and things like that. So anything that anyone would like to add at the moment? We won't do public comment. Teresa, I missed you. You just popped back up on my screen. All right. We did not have a quorum for, yes, we did. We did have a quorum. We ended up approving our minutes. So we need to approve the July minutes. Are you able to pull those up? There you go. July minutes were sent out. And Caitlin's going to scroll through just really slowly. If anyone has anything, if you've reviewed anything to add, anything to adjust. It was a pretty good conversation last month.
Definitely.
Is there a motion to approve the July minutes?
This is Kathy. I'll motion to approve the July minutes.
Thank you, Cassie.
And Karen, I'll second it.
Thank you, Karen. Okie dokie. We did our new member introductions kind of with our roll call as we went around. So unless there's any other questions anyone has for any of our new folks, we can move kind of into our kind of the core of our meeting. All of the links embedded in the agenda, if you were able to pull up the agenda, you will be able to access all of those documents. And we're going to go through them literally line by line today.
Yes, it's gonna be a day, everybody, but hang in there with us, and we can always take a break if needed as well. Because there is a lot of information to review today. So wanted to just kind of go ahead and jump into some of the things that I've been working on with regard to member training, as well as letters of commitment. So first of all, I wanted to show you a link to some of the council training that I've been working on. These are gonna be for all of our statutory required councils, so this is not just going to be specific to this council, but did want to kind of give you all an idea of some of the information that has been provided, especially to our new members. I wanted to give you all a chance to look at this as well and have access to this as well. So some of the training is going to be probably a little bit redundant for some of you all, but again, wanted to make this digestible for anybody who comes to serve on one of our councils, especially for people, you know, with just lived experience and no other type of background in mental health. Wanted to make sure that they are understanding their roles and responsibilities, you know, where we lie within the overall executive branch, what the BAA or the BHA is and our organizational structure. So just wanted to briefly highlight that here. Again, you have links to this slide deck, so you are able to kind of scroll through. And again, this is going to be our first step in a long process of training. We really want to support all of the members throughout all of our councils. And so if you see some information in here that you might have questions about, or you would like some further explanation about, or if you see information or you don't see information in here that you think could be useful to any sort of new member onboarding, I would really love to hear some feedback from you all, and just kind of work with you to continue to build this out to make sure that, again, new members are feeling supported, and we're clear in our roles and expectations as members of these councils. So just wanted to highlight that here, especially when it comes to some of the laws that we have to abide by, such as, you know, open meetings law, quarter requests, and things like that. Really wanted to highlight those here. Similarly, wanted to kind of go over this code of conduct with you all. This is something that we're going to continue to build out, and we would love to get some feedback from you all with regards to the code of conduct as well. So the ones that we really have highlighted here, of course, respect, attendance, preparation, engagement, professionalism, and compliance with applicable laws. So again, if you all can take some time between now and the next meeting just to review some of these information and jot down any notes, questions, comments, or concerns that you might have, that would be really, really appreciated from you all. Absolutely. All right. And next is our letter of commitment. And so some of our councils have already had this established. Andrew, do you know if this council did?
I do not recall.
Okay.
Did we get all the way through? I don't think so. I would just say do it
Okay.
again.
So our new members have signed this letter of commitment, but basically I'm going to be sending it out to all of you all to review and sign. It just basically, you know, goes over in brief, you know, what this council is, some of the things that you're committing to, such as, you know, your terms, and I'll adjust this accordingly to fit your respected terms before sending this out to you. And then basically just, you know, that you'll show up to meetings, you'll let us know if you can't, if you can. If you miss, you know, more than 5 consecutive meetings without any sort of notification or communication, basically the chair and the vice chair will have the authority to remove you from this council. Again, this is not like trying to like threaten you all or, you know, force you into attendance or anything like that. It's more so just making sure that we stay in active communication. You know, we completely understand that this is not your full-time job. We don't want it to be your full-time job. You have lives and roles and responsibilities outside of this. It's just if more of like a reassurance if for some reason members just go radio silent and we can't get in any sort of communication with them, they stop participating, engaging altogether. We just really want to be able to open that seat back up for a new member that would be able to engage and participate. So if you have any questions about that, please don't hesitate to reach out. Kind of keeps going over some things like that, basically, you know, that you're going to comply with the code of conduct and, you know, be respectful and be prepared and be engaged. And then it kind of goes over some of our commitments to you all as a BHA and especially myself as your BHA support staff. And then, yeah, basically a disclosure stating that unless you are already a state of employee, that you're just basically not entitled to state employee benefits. That again, if you already are a state employee, then you obviously are. But you know, just as a member of the council, we just like can't give you like paid time off and things like that, basically. So this will be coming around to all of you individually. If you can just sign, date, and return that to me, so we can just keep it in your files. Again, it's not. It's just more so that you all are understanding what you're committing to. We understand that you understand. Just you know, crossing T's and dotting I's. That's basically it. But if you have any questions, comments, or concerns about this, please don't hesitate to reach out. Again, this isn't meaning to seem threatening or you know anything like that. It's more so just a formality, really.
Accountability.
Exactly. Exactly.
The
All right.
slides that you posted, I know you sent those to us, didn't you?
Yes, and they are linked in the agenda here as well, under member training. All right, now the fun part. Bylaws.
It's everyone's favorite.
Woohoo! All right, everybody. Make sure you all can see my screen. Can everybody see that clearly? Do I need to
Yes.
zoom in anymore?
It's good. Thank you.
Perfect. All right, so as we discussed in the last meeting, our goals for today are just to go over these bylaws and make sure that we create, you know, a mission and vision that this council feels comfortable with. And then also going over, you know, roles and responsibilities of this council, its subcommittees, recruitment and things like that. Again, for Article 1, creation and duties, most of this is taken directly from statute itself. So it's all statutory language. So there's not a lot that we can change with that unless we take this back to legislation. And, you know, it's definitely more of a process. So Article 1, we can just review, but we really won't have too much feedback for. But then after that, that's when we start getting into, you know, the breakdown of the council, breakdown of certain roles such as chair and vice chair. We get into things such as like the recruitment strategies, processes, and timelines. So that is all subject to change for you all. Really just want to make sure that, you know, we're getting across roles and responsibilities, but we're also tailoring these bylaws to be specific to these councils, and especially you as members as well. So any questions before we jump in there? All right. So coming down to our mission statement. So when thinking about our mission statement, we want to start highlighting, you know, current activities and to be able to answer the question of why do we exist. The mission statement should include what this council does, the purpose and or what this council wants to achieve, and its values or how it wants to achieve these goals. And thinking about the communities that we serve and how we serve them. So any thoughts around mission that come just, you know, off the top of the head?
This is James. Would it be, and I only recommend this because we've done some of the same work in both the Park County and Teller County Mental Health Alliance. And one of the exercises that we did in both right away was just kind of word vomit. And go around and everybody just throw out like, you know, 5 or 6 words that kind of characterizes what they think this group is about and what they see as the mission.
Yeah.
So would that be helpful?
I think so.
Sounds good. Do you want to go ahead and start us off?
Absolutely. Empowering people for whole wellness.
I like that.
I can throw something out. Advancing behavioral health and well-being across Colorado.
Love it. I think one of the big things we've been asked about over the last, at least my time here, is being able to bring our respective observations that we see to this board so that we can, like the title says, advise the BHA, the commissioner, about things that we see on the front lines. Right? There's word vomit that's not finessed, but you know, we're bringing our respective observations and experiences.
Yeah, I like the word
Recommendations.
advise and support.
And maybe advise and recommend.
I was just gonna say recommend.
I was just gonna add, you know, in thinking about the mission and hearing the last comments after the folks started talking, I was thinking, you know, it could go one of two ways. And I think the comments have demonstrated that one would be really broad, like wanting, you know, better behavioral health for the state. And the other would be more like what this board does. So is there a you know, kind of what direction that in general the boards are going for the mission, like in terms of more narrow, like the board, like, you know, advise and recommend versus, you know, good behavioral health outcomes for Coloradans?
And I could build off that. I guess, you know, I love the bullet points that are there. In my mind, those feel a little bit more vision-y, like what's an overall, what are we advancing? When I think where Renee is getting at, it's like when I think about mission, I think a little bit about like, how are we developing like well-informed standards, rules that allow execution, help us execute some steps in service of that vision.
You were gonna say something, Kate.
I forget what it was.
I think the other thing this board is about, when you think about the 2765, it's about upholding people's rights. Somewhere in, and maybe that goes to vision with what matters, but it's also, why do we exist? So it's very much a advocating for liberties and people's rights.
I like that.
It's my soapbox.
Yeah, especially thinking of like, why do we exist? Upholding their rights while also, you know, safeguarding the mental and behavioral health of persons.
Yes.
Yeah, I was just gonna say something similar. It seems like it's the balance of the two, ensuring the rights are upheld while also the services.
I was trying to find in my documents the explanation of this board when I was appointed. Do you have that?
Yeah, so let's scroll over to statute. Can you drop that in the link address? Going to 2765.
I almost heard it.
So I don't know if you heard me. I asked what the description was of this board, and I think we should just review that too, so we can tie our mission and vision to what the description is, to the public facing description.
Andrew's gonna be dropping that into the chat for you all. So the actual statute is 2765-130. And that is this advisory board. So it reads that an advisory board referred to in this section as the board is established for the purpose of assisting and advising the commissioner in accordance with subsection 2 of this section and development of service standards and rules. This board consists of no fewer than 11, but no more than 15 members appointed by the governor. And then it breaks down into basically the seats that are going to be listed farther down into the bylaws.
So that brings up another thought for me. Leveraging experiences to add value to services
I like
or
that.
processes.
I like that.
Leveraging experience to add value to processes.
And I was looking at what Scott wrote in the chat, developing standards, rules that protect Coloradans' rights, quality, accessible, affordable, just, and excellent behavioral health. I love that. I was gonna copy this. I don't have access, Caitlin. I just requested.
I did just give it to you, yes. I made everybody commenters, so that way we don't get in here too many hands in the pot to like actually go in and like edit a lot of things, but everybody can go in and make comments and suggestions and things now.
Thank you.
Of course. And then dropping in the chat. So this is the link to the statute for our board. And then it's really the part here is the development of service standards and rules. And that's with regard to 2765 in totality. So that has everything to do, you know, with mental health services specifically.
So I'm not going to join to log in to join to log in.
You can if you want. You don't have to, right? Just means you're more local than this actually, but you feel like.
Is the, sorry, I'm already doing this, my attorney.
Yeah.
Under purpose, which is what I've been, that's what we're looking at, that's the statutory language for what the purpose of this board is, right? And
Yes,
should that be 130 subsection 2?
for creation or duty?
Under purpose, it just says 2765 103, I think
Oh,
that's
yeah.
correct, yeah.
1032, this?
Should be 130.
Oh, sorry, thank you for that, good call.
Yeah.
I am certified dyslexic, so if you see throughout this, please don't feel free to like, it does not hurt my feelings to call those out. I'm like, that, yeah, I'm like, that looks normal, what are you saying? Like,
That's fine.
there is a brain.
Just not what I'm talking about.
Leveraging experiences.
Yeah, I was trying to
To
think
guide
of,
processes.
earlier, trying to, what you were saying and what you're saying, like a layman's term for like the stakeholders' viewpoints, bringing
Yeah.
that into it,
Mhm.
so.
Yes, I'm trying to see if that's what.
But really, that's what we're adding voices,
Yeah.
right?
Yeah.
To, not only to, you know, persons with lived experiences, but also other providers.
Mhm.
We're
Yes, that's.
Does it make sense to think a little bit, at least for me, it's help finding I'm wanting to go to think about like mission versus vision, and would it make sense to make sure we're all kind of thinking the same thing about which goes in mission and which goes in vision?
Definitely.
Yeah.
The mission, I mean, I just looked up some definitions to remind myself, but like there's things like about it being things you're doing presently to reach your goals, visions more sort of long-term and aspirational, you know, visionary. So I'm trying to separate out in my mind like which things we're talking about might be more the mission side. It seems like some are kind of more the vision side.
Mhm.
What bullets should we move down to the vision? What do you all think should be? Like those first four are, to me, why we exist. But why we exist is also kind of what matters to us, so let's divide it out.
And there will be some overlap to these as well. So we can, you know, reiterate some of these statements within the vision as well.
And then someone gets to put this into a sentence.
That's probably gonna be my job, I'm guessing.
You do it so eloquently.
Some days.
And maybe I'm thinking of it wrong. I've always been taught that kind of like for mission, it's why we exist.
Mhm.
And then vision is how we're going to accomplish the things that we're set out to do.
So maybe that first bullet point, we could move down to vision.
How would we empower?
I think just by giving voices to all the different areas as the statute lays out.
We also are open to the public, so we're we're asking people to join and to listen in, and we always put public comments out and or ask for public comments. So that everybody has voice, it's not just.
That's a good point. Oh, go ahead.
Sorry, I'm just thinking, like, getting down to the nuts and bolts. We are supposed to recommend the rules and regulations and give feedback on that. I know that's the commissioner doing that, but who's doing
Well, it depends. We are actually in,
Because I don't think they've been rewritten with the new statute yet.
so we have the first round, so BHA has a number of rule volumes that we control, like depending on the subject area that we're in at the moment that we're regulating. So we have provider rules for like BHEs and 2765 designations that we regulate directly in 502-1 CCR volumes, and those are that was the big rules stakeholdering and rewrite of last year that went into effect January 1 this year with a little bit of delayed enforcement to help our providers get ramped up to where they need to be. The second round of those provider rules updating in this realm for those entities that we regulate directly will be this fall, early through the spring, and then hopefully before the BOSOs come online, July 1, 2025, right? And then we're doing systems rules, which is a more BHA expectation for the services themselves and how they fit into, and those are commissioner promulgated, as opposed to going through the State Board of Human Services. That's the main promulgation difference, though administratively, it's the same kind of authority and function, just based off the subject, we're promulgating them in a different way. But all of that stakeholdering is happening throughout September, October, November. We'll have a ton of communications about it. So where those rules from either set, I would say provider or systems commissioner rules, touch on involuntary service standards in 2765, because there will be a number of intersections. We will, you're like, oh, a few? Exactly. We will be bringing those proposed draft rules to this board, as well as the fact that y'all are encouraged to come to the big rulemaking stakeholderings and submit written comments and recommendations to things like that. So we at BHA envision that this board is very involved with the regulatory drafting of anything along those lines.
So
Really helpful.
is that, so the BHA, sorry, I'm trying to understand this a little bit myself. The BHA doesn't actually have its own type 1 board, and so it's.
Correct. We are a type 2 entity under CDHS, which means that CDHS, our Human Services Department, does all of our back-end supports, all of our administrative kind of office HR supports, legal supports and things like that to make us a functional agency because we reside within. However, as a type 2 entity, we are our own administration for the purposes of the subject matter and what like the commissioner controls relative to access equality.
So does DHS only have one type 1 board for everything that, and I know they do a lot, so.
Yes, that's why the CDHS board is so large.
Wow.
Exactly. And so it's appropriate for us sometimes at BHA as a type 2 to promulgate rules through the board because it allows that extra systemic oversight. It brings more stakeholders to the table, like, and more providers. But when we're talking about systems rules and vision rules and mission rules and what the other agencies and intermediaries have to come up to at a systems level, that is more appropriately promulgated by the commissioner as a type 2 commissioner, not an executive director.
That makes a ton of sense.
Okay, I know, I'm trying to explain this and we're getting better. We're getting down from like a 5-pager to a 1-pager about this. So hopefully more communication's coming soon. We will try to be overly communicative with this board because again, there are a lot of intersections as you guys are recognizing.
That's all. Thank you. Let's hope.
Coming back, to mission and vision. So we have empowering people for whole wellness, advancing behavioral health and well-being across Colorado. Bringing respective observations to advise, recommend, and support. Holding the right of all persons, but also sharing the mental and behavioral health of those persons. Develop rules and standards. Leveraging experience. So in thinking about what we do, how do we do that? So we empower the whole person health wellness through public participation and engagement and representation of community voices. How are we advancing the behavioral health and well-being across Colorado?
By making the recommendations that are coming to us from everything that's listed below. The voices, the comments, the observations. And that also is part of the explanation of why we exist. To recommend standards relevant to the provisions of 2017.
I agree with that. It seems to make sense to, really draw some directly from the language of the statute.
I don't know if this is something for the bylaws, but I think, can we maybe define the way we give this feedback? Do we report on a certain frequency? Who do we talk with? It's like we're developing these things, but what are these recommendations, but what are we then doing with the recommendations?
Yes.
I like that, Dr. Rice. Make it actionable. So we have directing.
Yeah.
Like that in a purpose. Because there's nothing beyond creation, duties, purpose that really gives that definition, but that really does. And the devil's in the details sometimes, and that really is some very clear explanation. I like that.
Yep. And Dr. Rice, we are going to be talking about later in this meeting, the annual letter of recommendation. I have a couple of templates that I wanted to show you all from some of our other councils that we are working through right now. BPAC just submitted their letter of recommendation. BHAC is about to submit their annual report. And so because those two kind of look a little bit different, I wanted to show those to you all to see, how you would like to start this process. So basically the letter of recommendation can be a much more abridged version. And we can kind of look through that in a little while as well. And then if we wanted to do an annual report, that would be, a lot more in-depth with a lot more information. But we can also, use that to start not only, voicing our concerns about certain things, but also making our recommendations on how potential solutions with regards to what we're advising on with standards and rules and regulations and things like that. So that's something that we'll definitely talk about today and kind of get a game plan with that moving forward. For submission with that timeline, I was kind of thinking, a September 1st deadline, and do this at least, a report or letter of recommendation annually. And so that way with the September 1st deadline, the BHA can incorporate that into its larger annual report that's due to legislation on October 1st. And then from there, we can kind of use our letter of recommendation or our annual report as kind of like a guide for the next year worth of meetings. So based on, the recommendations that we have, we can kind of plan out accordingly, to get, you know, certain speakers in, certain state agencies in, certain different types of partnerships in to come and speak with us about our recommendations that we made. So then it kind of can give us a bird's eye view of, you know, what our goals for the upcoming year will be, how BHA incorporated this letter of recommendation into its annual report, as well as its actions and services and deliverables. And then we can review, you know, again, if it was done in a manner that we wanted it to be done, if we need to spend a little bit more time on it, we can review and say, you know, we thought we could implement it one way, however, now we're seeing that it might need to be implemented another way. So we can really kind of use that as a guide for our future meetings and future discussions as well.
Yeah, that sounds good. I was also curious, I mean, because this board existed before the BHA. For those people on the BHA on this call, you know, has there been any discussion about how we might be useful to the BHA? And is there some role that we could fill for them?
Yeah, that's a great question.
I like that.
I would honestly love if that could be a conversation and an expectation and understanding we could come to, because we tried this last year because the BHA was so short-staffed. They had no one to train. Laws had been changed and we're out there and nobody around the state understood what the new laws were, how to implement them, what it meant. You took a whole new subset of professionals and you gave them an authority to sign a piece of paper to take away someone's rights with no education. And so we spent how much time writing a letter, offering to help, saying, if you give us just, even if we come up with the tips and the bullet points, would you give us permission to start spreading the word, getting the word out? Because the folks on the front lines were in a state of panic. And so we put so much effort into that and we never heard back after we submitted it. So I'm wondering if this could be a conversation where, if this is something the board collectively wants to make a decision to be responsible for doing and accountable for doing, could we have a conversation with the BHA to say, what can we do for you? What could we do to be your worker bees at times? And then that way we know if we put this much effort into doing something, it's going to go to a specific person who says, okay, this is under an agreement we've made and let's come up with a plan. And that way we feel like we're being productive.
Absolutely.
And it's resource pooling too.
Yes.
We have
Yes.
channels you guys don't have and vice versa. I think that's a great idea.
Can I just jump in really quick? I don't know exactly how it played out with your letter, but I wonder if it had an impact, because we were able to hire not one but two specific 2765 trainers. And so
that
we
would be
need that work.
great to know if it was because that we made some voice from the ground. Like, it would just be great to have communication.
And I will say on that, it's funny, Monday or Wednesday, those trainers are actually training my new academy and coming in, and we've worked with them several times. I've had the pleasure of co-presenting with them at the State EMS conference. And I do feel like that, and I'm sorry, I didn't bring that back to the group because that's a good point, Jessica. I feel like they really did take that letter to heart, and it helped guide kind of some of the work they did in hiring the right people, because they definitely hired the right people for that work.
That's amazing. I would have just loved to know that, because I felt like when I clicked send,
It was gone.
it was done.
And
It
then,
never went anywhere, nothing ever came.
We never established that
Part of
feedback.
that's that, like
And acknowledgement that it
channel,
was received.
that bi-directional, and that's across boards. We've
Yeah.
had this conversation where it's like, what do we want those recommendations to look like? And so we know, so that there's an actionable expectation around, we know we get MHAB's letter
Yep.
around September every year and we need to be responsible.
Yep.
For that. It's helpful from both.
I do want to show you all, so for our other council, the PAC, They just submitted their letter of recommendation and the commissioner has received it and leadership has received it. And so now what we're doing is we're going through, we broke down their recommendations into different categories. And we're going through with the council as a whole and ranking those list of priorities and then sending it back to leadership. And so leadership from there is going to designate task owners. So, you know, for anything with regards to public outreach and public participation, that will go to the community engagement team. So we'll at that point be able to, you know, track who's going to be like responsible for helping start to implement these recommendations. We'll be able to talk with them directly at, you know, the status of implementation, you know, what's going on with some of our recommendations. So that's something that we can absolutely do next year as well. Once we kind of get our first letter of recommendation or annual report submitted, we can go then and start breaking down into priorities and then assigning tasks. So that way we have that level of accountability and that two-way communication pattern, so we can actually see, you know, how things were implemented and establish that full process feedback loop that we are missing right now.
I love it.
I like that. Can I go back to what you said, because that inspired something in me. What if, and I don't know how we would word this, or if there's even appetite for this, but what if we set space aside and established as a group an expectation that each of the divisions from BHA come once a year and ask us questions?
I think that'd be great.
Yeah.
So and so, you know, literally, hey, this month is this group, this month is this group, this month is this group, and we actually, you're coming to give us an update on what you're doing, but also we expect you to come with 3 to 5 questions that we can give you feedback on.
I think that's amazing.
Yep. And that's something that we can include in the letter of recommendation or annual report, making that recommendation, and then you all can also, you know, submit a motion within this council to make sure that, you know, not only is it going to be written through a letter of recommendation, but then there's also been a formal motion within the council to establish that communication and that check-in with different BHA agencies and leadership. So then it just holds us at another level of accountability that we would come in. And then I would love to, you know, we'll get back to this in 2 seconds, but you know, work with you all to establish, you know, an annual calendar. So that way we do kind of have a bird's eye view of, you know, what to expect for the upcoming year, certain deadlines, you know, for example, a letter of recommendation, when that might be due. And so that way we kind of know what to anticipate and we can start really being specific with the discussions that we have during these meetings, as well as, you know, the questions and the recommendations that we have as well.
Can I make a couple of, I know what I'm saying, if I'm talking too much, just tell me to shut up.
You're fine.
On the second bullet, can we change on the first line of the second bullet, what about changing the to meaningful? We advance behavioral health through meaningful recommendations around the rules and standards through the submission of both annual letters of recommendation as well as other timely recommendations. Wow, that was fast. I would say both annual letter of recommendation.
Through both.
There you go. I like that even better. And then what do we think about putting in a third bullet point to capture what you were saying and maybe incorporate some of what I was suggesting, if there's appetite in the group, and if there's not, please, let me know. But do we want to add a letter, you know, that says actively seek questioning from, I don't know how you.
Are you going in I was wondering where you were finishing, actively seek out ways to support, implement, be usable,
Actively seek in an inquisitive manner. I always, like, when we're dealing with clients, right? You always take that.
you're always curious.
Like, you actively seek from a position of curiosity. I see. Actively seek from a position of curiosity.
Perspective's different than our own.
Challenges and opportunity for guidance from the BHA or for the BHA to the BHA. We want to seek opportunities from the BHA to provide guidance. I can't wordsmith that. But.
So you're asking the BHA to tell us what they need so that we can go out and figure out how to get the information to report back.
Yeah.
It almost sounds like what you're saying is that we're facilitating community collaboration, like as being a liaison in a way. And I don't like
and information.
Yeah, I wouldn't say it just like I said it, but it's like you're facilitating that collaboration to ensure that the policies and rules and all of that set forth is informed by the community.
And then the community then gets the understanding and basic information in digestible, understandable manner.
Right.
Because this is so legalized.
Yeah.
Statutes are so legalized and open to interpretation.
Yep.
Mm-hmm.
So I love that community liaison between BHA
and
the public.
And the public.
I think back up to bullet point 3, health initiatives from a inquisitive position of curiosity. So we're actually using questioning. Or they're gonna, provide us with questions.
Mm-hmm.
So, and then I think the bullet 4 ties perfectly into that. Doc, what do you think?
Yeah. So how do you all feel about some of these bullet points right now? Are we at a space that I can give it a shot to put this into like a paragraph form and then we can come back at next meeting and review the paragraph form together and do a final stamp of approval or make adjustments as needed?
Sounds like a plan.
One thing, just to throw out there too, is I love the idea of, publishing a letter.
Mm-hmm.
And, maybe we don't have to specify this, but I feel like it's a letter of recommendations that I guess we're targeting towards the BHA, but it's also to make sure, right, the community, the public feels heard and that they know what we're working on too. So it's sort of like all encompassing there.
Definitely. And your letter of recommendation or annual report, however we want to do this, will also be published to the public facing website as well. So people will have access to that to be able to read that as well. All right. So for the sake of time, we can keep scrolling down. So again, Article 1 is going to be pretty much taken directly from statute. So not too much wiggle room there, but again, that statute link is in the chat if you want to go through and look at that as well.
Sorry, one last. Do we have anybody on today with lived experiences? I would love to create an opportunity or a space for someone with lived experiences to give some guidance in the mission and vision as well.
There's a whole group. There's a whole task force group there's a whole group of folks that the board is made up of. Individuals from various sectors of lived experience, from family members to personal, from substance use, SPI to. But I do know that I have seen folks jump on and talk when we have public involvement. I do know that.
Mhm. And we can start working with some of the other councils as well to kind of develop a council liaison. So I know, Michelle, you have been starting to participate with BCAP, especially because of their work with SAMHSA and your involvement with SAMHSA. And so that's something that we can start working with as well, is to develop a council liaison. And example for BHAC, one of our other councils, they are mostly made up of lived experience. So if we had, a council liaison come in, they can
That would be amazing.
offer.
Wait a minute, I'm on too many boards. Am I mixing, don't we usually, I remember
Yes, we
Ryan,
have some.
Ryan would say, bring board information.
She had the picture with the snake, yes.
Raina.
Yeah, so they have not.
How did I miss Raina with the snake?
Oh, she's a huge python around her neck.
That's amazing, okay.
Wait,
They have not.
but Ryan used to say, let's get board or committee updates, and there were two people, and she was always one. I don't know that the other person frequently attended, but they provided information, and she's on that lived experience board.
You're right, yes.
That's how I got that.
Yes.
So I don't know, she must have been a public attendee?
No, she was a board member.
No, yeah, so we do have a couple of people that have dropped off, so Raina was a consumer of mental health services, but they have not been in attendance since before I joined BHAC,
Okay.
or excuse me, BHA. So we can reach out to them to see if
Yeah.
they are going to continue. If not, that seat will open up. And then the representative that we had with families of persons with mental health disorders, they withdrew from the council. So that seat is open right now.
So that would put two people on the board
Yeah.
with that lived experience
Mhm.
voice. I'm happy to send an email to Raina. She and I have talked, I was like, is she my COPA person? Is she my board?
Yeah, that would be great.
If you could let her know that her experience is missed.
Yeah,
Mhm.
I'll do that. And then I would be happy to be the liaison back and forth, but I think that's a great thing to have those liaisons between councils.
Definitely.
Because it also keeps you from spinning your wheels and spending 30 minutes talking about something that was just talked about over here.
Mhm.
If it's talked about, you can then piggyback and go through what was presented.
It's like duplication of
Yeah,
efforts
yeah,
we're
yeah.
talking about across.
Uh-huh.
Yeah. No, I love that. And I would say that I wouldn't want to do a final approval of these without having some input.
Yes.
And yeah, there's no, specific deadline on when these are due. My goal would to be have them voted on by like January, if at all possible. But we can definitely, spend the next couple of weeks building this out together. And then again, you all have access to come in and make comments and suggestions. So if you have the time and bandwidth to do this outside of council meetings, you are more than able to go in and make the comments and suggestions that we can then, incorporate and talk about as a council as a whole as well. So definitely feel free to get in here and make any comments, suggestions that you might have, as well.
Is your email the Raina at AOL?
Yes,
Okay.
that's what
I have, I know a family member who's interested. I don't think she's applied yet, but she's going to. We share the same last name. We are not related. So be on the lookout for that, because I do think she's going to apply.
Okay. I'll talk with Ryan about possibly doing like an ad hoc recruitment and application period. Since this board is governor appointed, I'm not 100% sure if that is something that they are willing and able to do as well. So I know that we have every year we do like our one big reappointment. But I can definitely talk with Ryan to see if that's a possibility for us to, add more members throughout the year as well.
Yeah, he'll be our process guru there.
Mhm.
Who will be?
Ryan, we'll go back to him on that today.
Yeah,
Okay.
so,
Oh, thank God. He's a good.
so,
We love Ryan.
briefly skipping over, Article 1, creation, duties, purpose, according to statute, and my dyslexia.
Good catch.
I'm gonna go ahead and say yes to that one. All right, so Article 2 goes into membership, and again, this is statute language as well. So this is again taken directly from statute as to who should be serving on this board. One representative from the Department of Human Services, one representative from the BHA, one representative from the Department of Health and Environment, one representative from the University of Colorado, a leading professional psychiatrist, a member representing proprietary skills healthcare facilities, nonprofit healthcare facilities, Colorado Bar Association, consumers of services for persons with mental health disorders, and then families of persons with mental health disorders, children's healthcare facility, and public and private sectors. And then of course, in making an appointment to the board, the governor is encouraged to include at least one member with a disability or a family member or an advocate for persons with disabilities. Then for membership appointment, again, this is all pretty much taken from statute. No less than 11 members, no more than 15. They'll be appointed by the governor and serve a term of 3 years. You all do have the option to serve a second term, so a total of 6 years basically on this council. We did include here that council members are only going to be allowed to serve on one BHA council at a time unless you have written approval from the commissioner herself. Basically, we just incorporated that to ensure that, as many members of the public or, various agencies can participate in councils. So that way, one member isn't serving on all 4 councils, and possibly filling up, 3 other seats that we could have other opinions, and experience being brought to the table. So basically, we just wanted to include that here, but then also a little wiggle room for if, you are adamant about serving on this council as well as, BPAC, for example, if we can take that to the commissioner and get her stamp of approval from that.
I wonder if that's why Rita's not coming to this one, because she sits on the other one. And maybe they passed that bylaw, maybe they.
No other council has formally passed any bylaws yet. We're in the current stages of this right now, so that nothing has been set in stone with that. And then we do currently have some members from different councils that are a part of 2 different councils, so they're kind of like grandfathered into that. It's just mostly for, anybody new coming in that isn't already on those councils. Yeah, and you would be a liaison, so you wouldn't necessarily be like a voting member, so it would be a little bit different. But yeah, and of course, like, all of these meetings are open to anybody, so you can go sit and participate in absolutely all of the meetings. It's just to like that formal vote, that formal voting member is what we're talking about here. So yep, moving down on to new council members. So again here, and this is not just for this council either, but for all of our councils, we realized that there was a lot of confusion about, just new member onboarding, training, and how members are even being told that they have been elected as a member of a council. In my other council, we had an example of a person being like, I don't know if I'm a voting member, I never got the email, I never got notification. And so they kept showing up as a member of the public, but in our system, we had them as a voting member. So, trying to clear that up with this paragraph in specific. So talking here that, you'll receive a welcome letter basically from the chair and vice chair, similar to what you all had received. And that's going to include, onboarding materials, their training, a letter of commitment, And basically just stating again that you're required to review and comply with the laws and policies that we are all legally bound to. So that's gonna be, open meetings law, or any provisions set forth in these bylaws, and then the membership code of conduct that we reviewed in the slide deck a little bit ago.
Well, the certificate from the governor, I know that with the type 1 boards you get, that not something that you get with the type 2 boards.
Did you all receive that from
I
the
did
governor's
not.
office? Okay.
I know I didn't. I thought there was a
Do you know
letter though that you get from the
a
commissioner.
like a certificate upon appointment from the
Very
governor?
good question.
I thought all of the governor appointed boards, you got, which I know it sounds like a silly thing, but it's.
Well, but I mean, formalization of everything serves the point and
Yeah.
us, everybody serving the purposes, right? And it's not confusing. I'll follow up on that one.
Okay. All right, made a note to check in with that. If we do, we can add that in here that, you'll receive the welcome letter and certificate upon within 7 days of appointment. Any questions about that? Does that sound, agreeable? Does that sound, like supportive of new member onboarding as new members? Do you want, additional onboarding support and like holding meetings for you all, similar to like what we did with the office hours included? Or just really want to make sure that you all are feeling supported and comfortable within stepping into this council.
What might be great, like when I joined COPA, I learned a lot about legislation, the legislative process, representatives. They put together a packet that really explained certain things. So listening to this earlier, learning about the promulgation, the commissioner, the type 1 board, the type 2 board, if there is anything that could be just maybe a 4 or 5 page handbook, because I think a lot of us come into this with a lot of knowledge from different areas, but some of this, we all know in our respective fields, if you're not in it, you talk to people as if everyone knows what you're talking about. And then we forget sometimes that some people might not understand. So I think that would be great, is that.
I would say a video would be even.
Or a video.
Like it's just a
Extended.
5-minute video.
That's a
Yeah.
great idea.
So
You're having to type anything, just sit and talk.
yeah, that's actually one of our other councils, BPAC. We have a member who has his own like website and podcast, and he's actually going through and interviewing a lot of us. He's going to be interviewing Ryan in a couple of months to learn more about the legislative process. He actually just interviewed Jordan Bass, our data director, regarding the new performance hub and basically how to navigate the performance hub and interpret that data. And so we will be able to link all of his recordings and everything to our website as well. And I am working with our comms team to create like a new council landing page that is going to be linked to all the other respective councils, but it's gonna have all of like, it's gonna be like an information hub that's gonna have access to like handbooks and video links and training resources. And so that is something that I'm working on, and as soon as we get the statutory deadlines met, for September 1st, that this is my primary focus, is like not breaking the law. But yeah, it's fine, everything's fine, yeah.
But you've done so much.
It's unreal.
So yes, we do know that, we want to keep building out training with you all. And again, advice like that for specific trainings with regards to, the legislative process, rulemaking process, that's something that we can absolutely do to help you all feel more comfortable in these roles and advise at a capacity that you want to. Renee, I see your hand raised.
Yeah, I like the idea of including some more of that and then the type 1 and type 2 and all that. And you may already be drawing from this, but there's a CDHS webpage, the boards and commissions guide, which spells a lot of that out.
Yep.
Be a good resource, yeah.
Yes, oh yeah, that's actually how I've been working with Kyle Zenf over at CDHS. who's basically like my equivalent and taken a lot of the information from CDHS and want to create something very, very similar for BHA. So not trying to reinvent the wheel by any stretch of the means, but slap a BHA logo on the wheel at least.
Caitlin, I just wanted to say that, I thought, just as a new member, I thought the way that you organized onboarding was, I thought like that process was really good. It was the right amount of information. It wasn't overwhelming. Office hours is a great idea. I mean, I haven't been here for long, obviously, so I guess I can't tell like how well that'll prepare for future meetings. But in general, I just wanted to say that I thought, I think that process is really good.
Thank you. Thank you, Scott. And Renee, I did get your email this morning. I think that in my days of confusion, I just kept linking the same thing. So I'm working on getting you the links to the agendas and the meeting minutes and not just the contact list 4 different ways. So that will be coming out. And then I have also submitted a website request to our comms team to upload all of the missing meeting minutes and agendas to our public facing website. So that should be up by the end of this month. That was the deadline that I had presented them with. So by September 1st, all of that should be public facing as well. But I will be getting you the correct link shortly. So sorry about that. All right. So moving on, coming down to officers. So we are very lucky in this council to already have a chair and vice chair established. However, as we are working to establish them within other councils, we did want to, kind of lay out some roles and responsibilities of officers, and then also, not necessarily limit positions, but designate terms. So that way, if, another member of the council would like to step up and try an officer role, they'll have that space to do so within, their first or second term. So right now, what we're doing is we're trying to have each officer hold their position for at least 1 year with the possibility of re-election up to 3 years. So that way, that would be an entire term for a member. We just want to do the annual elections just to make sure that, everybody within the council is still feeling comfortable with the leadership that is in place. And also, just make sure, we're communicating, and if for some reason, obviously Michelle and Jessica are doing a fantastic job, or Jennifer are doing a fantastic job. So not worried about that here, but for other councils, if we start seeing that a chair or a vice chair isn't really necessarily protecting the voices of council members as a whole, and is just kind of, becoming the all-encompassing authority, want to, do some checks and balances there as well. So that's kind of why we talked about, the 1 year with the possibility of re-election up to 3 years. So we would hold July elections at July meeting, so that would be next July meeting. And so basically we have selected July because that is the start of the state's fiscal year, and that's going to be, kind of like a refresher month, for next year. New members will be onboarded in July. July will kind of just be like a reset, refresh. We'll plan out our annual calendar, we'll look at some other information and just use that as our time to reset and regroup and get ready for the year ahead.
So my only thought on that, I'd love to hear from the group, are we hard and fast on the July? Because we tend to have really low participation in July.
Okay.
And I'm wondering if like the January one wouldn't be better, because we're towards the end of the month anyways, and everybody's back from vacation by January.
Yeah.
Just a thought.
I would say, I was thinking March, end of first quarter going into second quarter, but I think you're right, July is midsummer and that's hard.
Yeah, we could even possibly do it at like September meeting, because if we do that with the annual report, for example, if we link the annual report with that September 1st deadline, we can use that annual report to kind of like build out our bird's eye view for the year. And just kind of use September as our restart refresh. What do you all think about that?
This is really high attendance.
Yeah, no, I like that. That's
That's great.
Yeah, consistency in September. Sounds good.
All right, so we're gonna be changing that to September. All right. So basically, the next paragraph just breaks down some of the roles and responsibilities of council officers. And so basically, the chair will be the parliamentary authority of the council. And they'll preside over the council meetings, they'll help supervise activities and business affairs, they'll make sure that motions and resolutions are carried out. They'll help to assign tasks such as, setting of agendas, recording of minute meetings, and help to place members according to seats. They'll be responsible for new member correspondence, including that new member welcome letter and orientation package. They will be serving on the executive steering subcommittee that helps to create the agenda and just kind of acts as, a smaller branch of the council for a whole. And then basically, if the chair is unable to do that for any stretch of the mean, for any particular reason, the vice chair will step up and take those roles and responsibilities. Similar to exactly what Michelle is doing here today. So.
My demonstration.
Here we, again, just for a safety precaution, stating that vice chair may be removed if it's in the best interest of the council. It will only be done basically by a proposal from this council. It will be called, a meeting will be called from the council, and at least 30 days will be given notice to the officer, and then officers may resign at any time through a formal written notice to the council. And then basically, if a vacancy exists, the council will vote on a new officer, and and then we'll get them refilled there from there. Does that seem pretty agreeable to everybody? Is there any questions, concerns around this?
Can we do that if it's a governor appointment?
Mhm.
Okay.
Yeah, you have the authority for this council to do that. Right, so I'm not seeing any too big red flags, so we'll keep moving on for the sake of time. So breaking down subcommittees, and so basically we wanted to reiterate here that for all of our statutorily required councils, each council holds the authority to create a subcommittee to act on behalf of the council as a whole. And so basically here we just kind of broke down the roles and responsibilities of subcommittee members, that a subcommittee may be created by the council as deemed necessary to facilitate the activities and business affairs of the council as a whole. Council members may volunteer to become a member of a subcommittee, and members shall be appointed by the council chair. A chair and vice chair of the subcommittee is to be designated by the members of the subcommittee. The appointed subcommittee chair shall be the parliamentary authority of the subcommittee. Basically, it's the same responsibilities as the full council chair, just in that subcommittee. Same with the vice chair.
Are we using Robert's Rules of Order?
Yes.
Okay, was that said somewhere else?
It's gonna be, and it's gonna be farther down, we'll use Robert's Rule of Order, and Robert's Rule of Order is included in the training slide deck as well. It's just like a very abridged version, so we can use the Robert's Rule of Order to, keep moving forward and some of that language, but we won't have like the full Robert's Rule of Order and everybody in powdered wigs with a gavel and, although we could, I'm down to get powdered wigs with you guys.
Unless y'all want a gavel,
It could be really fun. I vote for the Halloween or for the October meeting.
Can we do it in costume?
I'm down.
Alright, sorry.
So any questions about, subcommittee creation or participation? And we go into a little bit more detail about subcommittees further down as well.
That all seems very appropriate to me.
And so with regard to subcommittees, anybody can volunteer to be part of a subcommittee, and we will possibly work to create a letter of recommendation report writing subcommittee. Because I know myself, when I was in grad school, trying to write a paper with more than 3 to 5 people, it's just a nightmare. So, everybody here trying to write a paper together can just be no. So that way, we can have just a couple of people come together to help create this, but then we'll bring that information back to the council as a whole to get your feedback and your input and your recommendations. So you're still going to be involved with the activities of the subcommittee. It just won't require you to, be at every single meeting and have to participate at, a certain level. But the council as a whole will always be informed of the subcommittee's work, where they're standing, and will always be seeking your feedback from the council as a whole as well. So just because the subcommittee is created doesn't mean that this council will never have anything to do with the work of that subcommittee. You're still going to be very much involved.
Love it.
All right, so coming down to recruitment. I'm gonna jump back to the slide deck for a little bit because I want to show you all the visual around this to help make a little bit more sense. I'm actually gonna jump over to another slide deck that I've created.
How many slide decks?
So many slide decks, y'all. So many slide decks and so many forms.
You're so good at slide decks, though.
Thank you.
That's why I think I hate. No idea what it's there. You have no idea.
If I create something, I know the title of it. And I'm going to search for something, I'm like, what did they call it? What did they call it?
Naming conventions, it's hard.
Alright, excuse me, where I get
Or when you
to
have
us,
7 versions of the same
Oh,
one,
my God.
Oh, yes.
in 3
Alright.
different places.
Final. I work in hard copies for a lot of reasons.
Final. With a final, with a final capital.
2.1, 3.1.
alright, so this is our proposed recruitment strategy. This year was my first, obviously, my first time helping to recruit for this council and other councils, and realized that there was really no formal recruitment strategy in place, and so it was just kind of a frantic emails and so we want to get a lot more organized with it. We want to be able to really reach out to respected communities and individuals and be really as specific and target our audiences, and so that's why we wanted to create this whole recruitment strategy. So the recruitment period we've proposed will follow the state's fiscal year, with new members onboarding in July. Recruitment will be managed by the executive the executive steering subcommittee, and then supported by us, BHA. And then wanted to just note that applications will remain valid for up to 2 years. So if a member of the public applies to be on this council and is not selected for 1 year, their application will still be valid for the following year, and that we can pull that information as well and look to appoint them at that time. So in February, wanting to start working with the executive subcommittee to begin preparations. This is going to look like creating a networking email that you all will be able to send to your respected communities. And then also working with our communications team to create a social media campaign as well as newsletter articles. So the state has so many newsletters. And so being able to, tap into some of the resources that we already have, especially when we have to fill some of the statutorily required seats when it comes to state agency vacancies. So looking to start preparations in about February. Then in March and April, that will be the implementation of our recruitment campaigns and that open application period. So at this point, we'll be actively accepting applications, we'll be actively recruiting new members, we'll be actively answering questions that people might have about joining this council. And then in May, we'll come together with the council as a whole to review those applicants and make our recommendations over to the commissioner, or excuse me, to the governor for this board. And then we will submit our recommendations to the governor's office in June. That way they will have the entire month to look at our recommendations, and they'll be able to take into consideration, you know, why we've recommended certain people for certain positions, whether it be, you know, a statutorily required seat, or they have, you know, detailed lived experience, and we think that their perspective and their lived experience and expertise would be extremely valuable to our conversations. And then lastly, new member onboarding would begin in July. So very similar to what the new members have experienced, you know, you just be receiving your welcome email. We'll be holding office hours for you all, you know, completing some training, being able to ask us questions, and signing that letter of commitment and getting us back, getting that back to us by basically the 1st of August. So that is the visual of what has been broken down into our recruitment process.
That fits beautifully into September and our restart, because everyone comes on, they get their first, you know, kind of couple meetings in, or a meeting or two in, and then September.
I have one thought.
Just the one?
Well, our current situation is a perfect example. I think that there's really, in the entire group, I think there's one position that's so critical that I don't think we could wait 6 months to a year to fill.
Right.
And that is someone with lived experiences.
Right.
So I think in acknowledging it, and I, again, love input from the group. I think if we don't have someone with lived experiences on the board, that we should identify that position is so critical that we would attempt to fill it outside of the.
So I pulled that slide deck back up because this is for another council that we have. So for those, we do have an ad hoc recruitment schedule that will basically only occur if there's deficiencies among designated seats as defined by statute. And so because, you know, families of persons with mental health disorders. There we go, is, you know, laid out in statute, that is something that, for example, this council would do. However, because this council is unique as it is appointed by the governor, I need to double check with Ryan and the Gov's office to make sure that that is something that we can do. Because I know that their deadline to get submissions.
What's the name of our point of contact? I'll think of it as well. I'm sorry, just to put you on the spot, but we can vet that from our end.
Yes, so that's something that we'll absolutely look into. And if that's agreeable with the Gov's office, then we can do an ad hoc recruitment strategy like this. And so basically, it wouldn't include things as like a social media campaign, but we could use, you know, the newsletters and the emails, to get those seats filled. It would just be, you know, much more of a bridged version and condensed version of the larger recruitment process. But that's something that we can absolutely look into, and I agree that we should.
And it helps fill vacuums.
Yes, yeah. And, you know, if a member for some reason has to withdraw from the council, something comes up and they just don't have the time and capacity to serve, we can also use this to fill those seats that become vacant throughout the year as well. Cool. So coming back to our bylaws, that is basically just broken down in here. And then I will add a note about checking in.
Doing another job making notes in the document. I'm just taking some.
No worries. I have like so many folders everywhere. I'm like, I've started realizing if I don't do it in the doc, it's like, Lord only knows where that city went. So here again, kind of breaking down, you know, what the recruitment activities will consist of. Myself working with the communications team and you all to create recruitment strategies and content. Again, could include email drafts, newsletter articles, social media campaigns. And then the councilor's designated subcommittee will review and approve this content during the recruitment preparation period, and standardized recruitment process. So that February month is when we'd be reviewing this together. And then again, it kind of goes down into the appointment period. So in May, we'll review our applicants and send that over to the governor's office by June 1st. And then the governor's office will have until June 30th to get us back our recommendations with that formal appointment. And then we will reach out to new members, and they will be appointed beginning of July 1st. So the applicant referral package, this is something that has already been used by this board. This is something that we're actually implementing into other boards and councils as well, because it's like the most organized referral process that any of our councils have had. And so basically it's just like a packet that includes a bunch of different information, such as, you know, clearance sheets, enabling statutes, a letter to the appointing authority. So in this case, it would be the governor. And then a breakdown of, you know, the current board composition, who sits on what seats, what demographics we might be missing, and things like that. So again, this is something that this council has already used previously, and we're just going to continue to use and implement throughout other councils. So that's why it's just broken down a little bit more detail here. All right, so coming into our membership requirements. So basically here, we are really trying to hold members accountable for engagement and participation and communication. Again, we realize that you all are not going to be able to make every single meeting, and we're not asking you to. We totally respect that you have lives and responsibilities and full-time jobs and families and all of that. So what we're really just asking here is that you all just remain in communication with us. Even if you can't let us know beforehand that you're gonna miss a meeting, if you can just, you know, check in afterwards, be like, hey, I'm so sorry I wasn't here. I'll review the agenda and get caught up for next meeting. That's great. That is basically all we're asking here. What we're trying to assure here is that, again, if members just stop participating altogether, they stop emailing us, they stop answering our emails, they stop coming to meetings, they stop participating in subcommittees. Basically what we're trying to do is after 3 meetings like that, so basically 3 months of zero communication, the chair and the vice chair will reach out to that respected member just to check in. Make sure, hey, are you doing okay? Do you need help? Or are you alive? You know, and then again, if there's zero communication back from them, and they continue to miss the next 2 meetings for a consecutive 5 meetings, so that's 5 months in a row, we will have the authority to remove them from the council. And again, that just kind of opens up space for us to get new members on that are wanting to participate and engage, and also make sure that it helps us reach quorum at every meeting. Because the months that we don't reach quorum, some of the conversations that we might have, wouldn't necessarily be able to move forward within like recommendations and things like that if we haven't established that quorum. So we're really just trying to ensure that quorum is reached and everybody is communicating and you are participating and engaging as much as you can. Does that feel pretty agreeable here, or do we have some comments or concerns about any of this as well?
That's pretty reasonable.
Okay. All right, so jumping down to Article 3. So actually, I'm going to pause here because I know that we only have 20 minutes left in this meeting, and I would really like to look at the letter of recommendations with you all. So is it agreeable with everybody that we kind of pause at Article 3 right now, and we can continue during next meeting to finish out the bylaws, or we can hold office hours as well for members to come and participate and work through bylaws outside of these regular scheduled council meetings?
Do we need to make a proposal or?
Yeah, just making sure, just giving you all space to be like, no, we have to finish it today, you know, like. You really wanna do bylaws all day, you know? All right, so I'm gonna jump back over to the agenda for a minute. And actually, I'm not gonna do that. I'm gonna go to.
Oh, we started at 10, didn't we?
Yeah, do. All right, so I wanted to kind of show you all some examples of two different reports that we've been working on with other councils. So the first is our letter of recommendation from the Behavioral Health Planning and Advisory Council, also known as VPAC. So here, their letter of recommendation is a lot shorter than what an annual report would consist of. So their cover page basically just establishes, they're actually a federally required board. So this is a federal statute that it's referencing. But basically it just kind of outlines, what the council is. They created a report subcommittee that met for 6 weeks for 1 hour each week to help organize and create this letter of recommendation, which again, I highly suggest doing for this council as well, because again, trying to write a paper with more than like 5 people is a nightmare. And so it basically just lays out that they were meeting and discussing this, and mostly their primary recommendation was the increased transparency around the annual report data. So we gave them, it felt like hundreds of pages of just like tables and data, but it lacked a lot of like clarity around the context of what that data is, where these funds are going, who's receiving these funds, the outcomes of services provided. And so that's been their primary recommendations. And so here, it kind of just breaks that down a little bit further into specific sections on where they were requesting increased transparency with regards. So, especially like rural and frontier funding and program access, data and metrics, especially when it came to the performance hub, performance measurements, and overall program recommendations. So as you can see here, this is only, I think it's like a 5-page document. Yeah, 5-page document. A vote was taken, and then the chair and vice chair sign. So this is one example of something that we can use to create our own letter of recommendation. The next is not that. Oh. It like pops up. I have to like move my screen every time, and I'm like, okay. The next is this annual report working document, which is being created by the Behavioral Health Administration Advisory Council, also known as BHAC. And so this one's going to be a lot more detailed. BHAC is statutorily required to submit this annual report every year on September 1st. So that's why theirs is going to be a little bit more in depth than just like a letter of recommendation. So here you can kind of see the table of content that has everything laid out with regards to the introduction, introducing the council, its mission and vision statement, a list of accomplishments that it achieved throughout the last year. It also goes into the statutory recommendations, which again is required by statute for this council. And then it goes into additional recommendations based off personal and professional experiences, as well as BOSOs. So again, you'll have access to this document to kind of go through and read it at your leisure. But as you can see, it's going to be a lot more in depth, a lot more broken down. Here especially when it comes to our statutory recommendations, we have it broken down into a couple of sections. For example, the system-wide grievance system. At the first one, the first paragraph, we introduce how the council was educated about the system. It breaks down a little bit more, the first paragraph is the council's understanding of what the system is. The second paragraph breaks down how the council was educated about the system. And then the third is the additional recommendations. And for their recommendations, they not only make the recommendations, but they also help to provide solutions to the recommendations, which is something that I'm finding really helpful, especially for BHA to implement, because, it's easy to just tell people to do things, but, helping them figure out the solutions as to how to do things and how to implement them in the correct ways has been really beneficial to the report of this council. So again, this is just another example of something that we can do for this council based off of your recommendations. So coming back to, I wanna pull up the meeting minutes from last month. That's not the point. They said from this month. And look specifically when it comes to this like running idea list, I think that this would be a great starting point to create either a report or a letter of recommendation, however you all would like to continue. But from this short amount of time that I've been involved with this council, you all have amazing conversations. You know the needs of your communities. Your personal and professional experience is unparalleled. And so based off of these recommendations, I really think, based off of this running list, I really think that we could use this to start that process of recommendation. So I wanted to give you all some space here to, kind of brainstorm, ask any questions, think about how we would like to possibly continue this process.
Go ahead.
James McLaughlin. I wonder, I'd be fine with either one of those formats, but I wonder if we shouldn't set ourselves apart. And first ask the question, who's our audience? And I think our audience is the policy folks within BHA, but also the legislators, right? Because we're trying to affect rule and statute, policy and statute. So I wonder if when I think about when I'm talking to those folks, I almost want to give an elevator speech and a 20-page document isn't gonna. What if we did a 1-page cover letter and then we did a spreadsheet that quickly in a couple of bullet points identified the problem, identified a potential solution, and then an action plan. So boom, 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 and then when you saw it, so problem, solution, action plan.
I like that.
I like that.
And our policy unit at BHA does house our legislative arm, which, they don't put me on the mic that much. Weird. Deep down, you guys all love me. So that is Erica Gannett. She's our legislative affairs officer, and she is super plugged in downtown every session, would love to come to this group, talk to you guys and all that alignment. So you do have that resource to support from BHA. Although that's not the only call of what you guys do legislatively as far as it relates to how we interact, we've got the right people for this board we can bring.
Well, and to build on that, and then I'll step aside. Just be quiet for a minute. To build on that, I wonder if we have the 4 members, and I'm gonna throw my hat in the ring right away. But we have the 4 members that sit on that panel, that subcommittee. But what about having a representative from the policy team as an advisory capacity for that committee as well? And I think that because one of the things I wouldn't want to do is maybe she's the perfect person for that. I wouldn't want to make recommendations that don't take into account statutory realities and policy realities. And I found it on having a policy wonk. I love that term. That's a term.
I am a policy wonk. I love it.
And I'm going at heart. But having a policy wonk on that group, I think will keep us make sure that the recommendations we're making are actionable.
Yes. Based in, we consider ourselves in policy the reality testers.
Yes.
A lot. That's like our main function of what can we? So.
Yeah, and I'm
very happy about that.
So, yeah, no, it's.
I agree with you. I think the shorter, the better, the more simplistic and brevity being our motto, and then visual being our goal. I mean, because I think when words are just jumbled on a piece of paper, so I like that one-page summary. And then it can be kind of like the documents that you see everywhere. It's a paragraph, but if there's something in there that you want to refer to, just link it and put an appendix to that. If you want more info on this, why should I re-summarize it in this document? I'm just gonna give you a link to it, and if you want to read about it, there you go. I don't have to.
And there's a lot of folks out there that have already done that. So we're not double lifting.
I feel like the world is full of so much stimulus and stuff, and it's everywhere. If we can just cut to the chase, be less wordy, and then have links to things that people don't understand and want to find out.
Pithy.
Great. So with that being said, how does everybody feel about that September 1st deadline? Does that seem pretty reasonable? Because obviously not this September. No. Yeah, how do you guys feel about Monday? Yes, so for next year, so 2025 would be like our first official submission, and then we would just continue that September 1st deadline. Again, my reason for proposing that date is because that way when we send it to BHA, they can incorporate it into their annual report, which does go to legislation as well. So legislation will be able to see that through the BHA report as a whole, and we'll be able to, specifically target those demographics that our audiences that we're trying to reach. Does that sound pretty agreeable to everybody? Is there any other date that you'd like instead?
What date was it? Sorry.
September 1st.
I just wonder if anybody online had any thoughts on that format. I want to make sure we create some space for that.
No, I mean, I think it looks good. I'm sorry, I was gonna say
go
ahead. Too much space, everyone's leaning in. The spreadsheet, I forget which committee it was, if it was BPAC, but you showed an example of recommendations and action items. I love that model. I mean, I would say do that if it works for them.
Okay, sounds good.
I was actually envisioning that when you said problem.
Yeah.
So I was actually thinking of that.
100%.
Yeah.
Because it's very clear.
Yeah. My only thing with like a table and spreadsheet like that is we will definitely need to work with our comms team for ADA accessibility for screen readers. Because tables can be a pain to be able to access any sort of table and stuff. So we'll just need to make sure that we finish that with the letter of recommendation within enough time frame that we can get that into a screen readable format for with our comms team. But that's back of the house stuff that you all don't need to worry about.
What about info topic?
Thing.
Yeah.
Yeah. All right, so cool, it's September 1st. So with that being said, I'm going to drop this link in the chat. It is also linked to the agenda that you all have. But basically wanting to get any, start getting a feel for anybody who might be interested in creating that subcommittee. First of all, do you all feel comfortable creating that subcommittee? Is that something that you would like, or do we want to try and write this as the council as a whole?
Or a subcommittee.
Subcommittee? Okay.
I mean, if you have 3/4 of the board that says, I want to be on the subcommittee, then we just take more time to do it.
Right.
But I think that would be,
Right.
I think a committee. That way we don't press people for time who don't have it and make people feel pressured.
And I don't want to take away from the important work that they.
Yeah, because again, this allows, you to still be a part of the report writing process. However, you don't have to spend that extra time and that extra commitment if you don't have the bandwidth or the desire to do that, which again, totally fine. So this application, it's super, super simple. It shouldn't take you more than like 2 minutes to complete. Basically, you'll just do name, email, your representing community. And then select as many times that work best for you all. And then basically just making sure that you agree to be on the subcommittee. So what we were thinking about proposing is starting this in January. Yes, so the second week of January, and hold it monthly until August. So for 1 hour, once a month, the subcommittee meets to start, reviewing recommendations, putting them into that digestible format, coming up with solutions based on that recommendation. And then in August, we'll take all of this and we can continue to do check-ins with the council as a whole during meetings. This isn't something that we just have to wait until August to do. We can do this at every meeting, make this a standing agenda item. But in August, we will review the finalized recommendation with the council as a whole to get any last minute feedback or suggestions incorporated into that. And then we'll do that formalized vote and then submit it to the BHA on September 1st.
Dr. Simpson asked about a motion to create subcommittees. As we're creating something within the board.
Yes, we do need a hold of motion.
But I remember talking about this at the last meeting, and that's why I'm trying to find, didn't we vote on this last month?
We made the motion to create the letter of recommendation. We haven't made the motion to create the subcommittee.
Perfect, okay, I knew it was somewhere.
So we will make that motion. Thank you, Dr. Scott.
Yes. So this meeting,
gavel.
yeah. So for this meeting, now that we've got that, okay, yeah, I was like, I know we did this.
Yes.
So for this meeting, I will make a motion to form a subcommittee
I second that.
for report writing to the PHA. James. Thank you, Dr. Simpson.
I'm in reading through, looking at, the subcommittee will start in January. And then in August, the information will be brought towards the bigger group. I'm wondering if there should be a touch point in between January and August.
Definitely. So I was thinking that we could create this to be a standing agenda item, and then at every meeting, we just check in and say, this is what we've done so far. Any comments, questions, concerns? This is what we're planning to do by next meeting. And then just have that as that standing agenda item. It's just in August, we'll sit down with the council as a whole and go over the entirety of it. But yeah, we want you all involved throughout the entire year. So making this a standing agenda item, if that's agreeable with you all.
Yes.
Yeah, that's great. Thank you.
Of course. All right, everybody, gosh, that 2 hours flew by.
Oh my gosh, are we really?
Yeah.
Oh, yes, so we motioned, we seconded discussion, suggestions. Anyone opposed? Probably the easiest way to say that versus all in favor. Okay. No opposition, motion approved. Subcommittee 4.
So I have a question about this year, because I know we definitely have some really solid recommendations for this year. I'd like to make I would like to make a proposal that we form a committee that meets weekly to have a report ready for October. I was thinking October. I know we would probably miss the deadline for getting but I don't think I don't think it would give us enough time.
Yeah.
And I don't, so I think we have two options. We've now agreed to do this committee. So maybe if are you gonna send out an email? Do you want Jennifer or I to send out the email to say who would like to participate? Oh, you've got the.
Yes, the
So
application.
just send a survey out.
Yep.
And then if we could put a deadline on it, like please reply by next Friday.
Okay.
Because then if we do that, then we can say, does anyone have from this now stuff that we don't have to propose a
okay.
new one? Or we can do what we did with that last letter we did to the BHA and just we start like a Google Doc and we start with here are the 4 things we've discussed this year. If we could put it into a report by October and everyone contributes to it, that's how we did the one last time. So would anyone be in favor of one of those options over the other? I feel really bad. We had a lot of people drop off because the invite only went to 11:30.
Oh,
So we've got to make sure that our
that
hybrid or in-person meetings have.
they should be able to read
them.
them.
So when you send that email out, I think what we could probably do is, since this has been approved, send that out, Caitlin, and then ask everyone if they could possibly.
Important.
And I started going back through our meeting minutes from July of 2023 through to this year, because I feel like personally, we have had some really robust conversations about things and then they've disappeared because something else has surfaced. And so I've gone back through and I might be able to provide a summary in September
Okay.
about some of those things, just say, are these still important? We never really close the loop on these.
Sounds good, yeah. I'll create, yeah, I'll get that sent out by probably Monday, since I'll be traveling today. But yeah, we'll get that form filled out and get some answers by Friday and then work to set some time to get that up and rolling.
Beautiful, beautiful. I'll have to jump. At 12:03, we have kept you over. Everyone, thank you so much. Any last things before anyone has to jump off? Otherwise, enjoy your weekend. Dr. Simpson, thank you for all your contributions. Good to have you on board, and we'll see you next time.
Thanks, everybody.
Bye, everyone.